Welcome to another edition. Today we're fortunate enough to have Dr. Alvin Danenberg, best known as Dr. Dan, I believe. Dr. Dan is a periodontist with 40 years of experience, actually probably 40 plus years, a certified functional medicine practitioner and a certified primal health coach. So Dr. Dan advises and treats patients in person once a week, and then online he's available to discuss gum disease. He also consults in ancestral nutrition and overall health. Welcome, Dr. Dan.
Welcome to you. Thank you. It's just amazing that I am almost directly opposite in the world from you.
Yeah.
It's just crazy, right? And the craziest thing is, it's like you and I are speaking in the same room.
Yeah, it's so clear.
I just love it.
Dr. Dan, just for our listeners out there who may not be familiar with exactly what a periodontist does, so what do you actually do, and how would I know to come and see you?
I'm assuming that a periodontist is pretty much the same specialty all over the world. But in the United States, a periodontist first has to become a dentist. So you have to go through dental school, which is after college. So dental school would be generally a 4-year or so program. And then the specialty training in periodontics is approximately 3 years after that. So a periodontist is a specialist who treats specifically the gum tissue around the teeth and the fibers that attach the root to the bone and the bone that surrounds the tooth, as well as factors that affect that. For example, the jaw joint and the bite of the teeth. You know, when your teeth come together, they create a force that can damage the teeth as well as the bone. So all of this becomes the realm of a periodontist. Generally, periodontists would be consulted because a person has gum disease, they have bleeding gums, or they have a bad odor in their mouth, or they have teeth that feel loose, or even just jaw pain or jaw joint pain. All of that would be the realm of the treatment by a periodontist, and that's what a patient would generally see a periodontist for. In the United States, a lot of people come to the periodontist first, but most people would go to a general dentist who looks at their mouth and may see something that is more complex, or they don't want to treat themselves, and then they refer it to the periodontist.
Okay, so typically then you may get referred from a dentist.
Yes, correct.
So gum disease obviously is one of the things, apart from several others, but gum disease itself, how prevalent is that? I guess you can probably only talk with regards to the United States, but I'm sure that gives us a good indication. I'm just interested because I was astounded to read in one of your articles, I think it was a 2015 article, that mentioned something like 47% prevalence.
Well, actually, it's even more astounding than that. There is a published peer-reviewed paper. I think it was published in 2014 or so, but I can't remember, where some research was done with college students, and the researchers evaluated this statistically large sample to identify bleeding gum tissue. Now, the gum tissue around the tooth is as strong as the cuticle around your nail. So if you were to scrub your fingernail with a scrub brush to clean it, you would not expect droplets of blood to come out from the cuticle. And if you did, you would say something's wrong. Now, the gum tissue around the tooth is as strong and as healthy and protective as the cuticle around your nail. And if you brush or floss your teeth and there's any sign of bleeding, you have some kind of gum disease. Unless you actually cut the gum because you were too aggressive, there should never, ever be bleeding in the gum. And if you have that, it's called gum disease or gingivitis. So this study evaluated this group of college students, and they determined that 94% had gum disease. That's huge.
That's unbelievable.
So, you can interpolate that and see if that's the standard of the United States, but they summarize that this is the incidence or prevalence of gum disease or gingivitis in the United States. So That is a huge, huge number. You know, if you went to a dentist, and this is sad, but if you went to a dentist and you had your teeth clean and your gums bled a little bit, the hygienist probably would say, yeah, that's pretty normal, or it's not so bad. That's so wrong. I mean, bleeding is a sign of infection. So here's the prevalence of gum disease, gingivitis, which is just the infection around the gum tissue and slightly under the gum. However, gingivitis can progress to a more advanced disease called periodontitis. Now, periodontitis is actually a different kind of bacteria. Not all gingivitis becomes periodontitis, but you can't get periodontitis unless you've had gingivitis first.
Right.
So periodontitis is an infection in the bone that surrounds the roots of the teeth, and the bone actually starts to melt away. And the prevalence of that, and this is a huge study that was done in the United States in maybe 2012 or 11, I think, the incidence or prevalence is 47% of adults have periodontitis. And if you're 65 years or older, that jumps to 70%. Now, let's compare that to our primal ancestors. If you look at skeletal remains of primal ancestors that lived from 20,000 to 10,000 years ago, there are hardly any signs of bone destruction from periodontitis or tooth decay. But from that point on, about 10,000 years ago until now, the prevalence jumps to 47% for periodontitis or 70% if you're over 65 years old. There's got to be a disconnect. There's something going on. And it has nothing to do with brushing and flossing, because our primal ancestors didn't have toothbrushes or dental floss, yet they didn't have disease or tooth decay. If you look at primal societies living in the world today, and there aren't very many, but if you did that, you would discover that hardly any of those have gum disease or tooth decay. Some do, and there are reasons why they do, but hardly none of them have tooth decay or gum disease. So there is something going on, and it's significantly related to our diet.
Well, I think probably best to tell us about your personal experience. How do you know it's related to the diet, and what happened to you?
Well, let me go back first what happened to me, and then I can tell you how it's related to the diet. Because what happened to me was before I understood how diet was so intricately and intimately involved in the health of the mouth. I'm going to be 70 years old in 2 weeks.
Wow.
So when I was 59 years old, I had a stroke. I thought I was healthy at the age of 59. Obviously, I wasn't. And I had this stroke, and the doctors saved my life, and they put me on 7 medicines for the rest of my life. Now, that didn't sit very comfortably with me, and I thought, I need to figure out what I'm doing wrong. Now, I thought I was healthy, but obviously I wasn't. So I did a lot of research, and I went to sources that most people go to, the American Medical Association, the Heart Association, the Cancer Association. I went to all these organizations to figure out what I'm doing wrong, and I learned a whole bunch of stuff. And by the time I was 66 years old, I thought those 7 years I learned a lot. So I found a course at a center called Paleo Center for Yoga and Health in Massachusetts in the United States. And it was a 5-day course, and it was called Nutritional Intensive for Healthcare Professionals. And I was thinking that this 5-day course would just summarize everything I was doing and kind of tell me basically I'm on the right track. So the first speaker the first day was unbelievably phenomenal. He was one of my best friends today. And he talked about primal nutrition, and I never even heard of primal nutrition. And he blew my mind, and all of the speakers for the next 5 days just showed me and explained to me as a group, because it was a group of about 150 people, how I was doing everything wrong up to this point. So obviously, I'm blown away. So when I went home to my wife, she and I kind of bumped heads together, and I said, we're going to make some changes. And she said, I'll give you 30 days. So I completely eliminated all processed foods in my house. I started to shop at a farmer's market where we were buying fresh vegetables, organic vegetables. We were buying pastured meat and wild-caught fish and lots and lots of nuts and seeds. So I was starting to learn very rapidly how to eat totally differently and also to change my lifestyle. Now, at that point, when I was 66 years old and I went to this course, I was about 30 or 35 pounds heavier than I am today. But when I started eating healthy and creating a healthy lifestyle, I have now dropped 30, 35 pounds. I have reduced my 7 medications that I was supposed to take for the rest of my life to 2 that I only take intermittently, and I'm phasing those out. And I can tell you right now, I am healthier today than I've ever been. So what I learned, I felt that not only it was helping me, I knew it could help my patients. So I've been practicing periodontics at that point for 37, 38 years. So I needed to integrate all this new knowledge into the way I treated gum disease. So I started doing that. The way I treat gum disease, advanced gum disease, is I use a very interesting laser procedure that actually helps your body to develop new bone as well as destroy the very virulent bacteria. But then I also have incorporated a diet that is based on primal nutrition and supported by a primal lifestyle. So stress reduction and efficient exercise and restorative sleep are all critical, along with nutrient-dense anti-inflammatory foods. So this is how I started to get my head together. So I did a study in my office in I think it was around 2014. We took about 13 patients. We examined their teeth for gum disease, and there were ways to measure for gum disease. For 30 days, I put them on a supplement of natural kelp, which gave them plenty of iodine and other trace minerals, and also fermented cod liver oil with high vitamin butter from a company called Green Pasture. And they got significant vitamin D, vitamin A, a variety of nutrients in their system that they never had. And after 30 days, we did remeasure all these pockets, and there was a significant reduction in the depth of the pockets, the infected spaces, as well as bleeding. So that is telling me that nutrition has a lot to do, because nothing was changed other than these natural supplements that they started to take. Now, I'm not a believer in supplements. I'm a believer in real food. And these supplements were really real food that were encapsulated. So once I did that, and then I did more training to learn about functional medicine and being a health coach, a significant amount of reading. And there's so much good peer-reviewed literature, research in the last few years that demonstrates without a doubt that if you're eating a nutrient-dense, anti-inflammatory diet, your mouth will get healthier. And by the way, all of your organ systems get healthier. Chronic disease becomes not a significant problem. And I think that that is the answer for quality and longevity in life. I just need to get that message out to younger people before they get so damaged from destructive chronic diseases and degenerative diseases that it's very difficult to get back to a healthy state.
That's an amazing journey you've had. So just to recap then, so for the first 38 years, you did more of a traditional surgery on the gums as opposed to the new...
Correct.
Okay.
Yes, that's correct. I was trained traditionally. I was doing all the things that you would think that a periodontist would do, which would be take a scalpel blade and cut the gum tissue open. Of course, you'd be numb, you wouldn't feel it, but still, and treat the bone and do all kinds of chemical things in the bone and close the gum tissue with stitches. And then you as a patient would deal with healing, and the healing would cause swelling and pain and sensitivity and all kinds of stuff. Now I've used a procedure called LANAP, and that's an acronym that stands for Laser Assisted New Attachment Procedure. And it's now done all over the world. And it is a laser procedure where a little fiber optic light is placed under the gum. Your mouth still needs to be numb, but there's no cutting of the gum, there's no stitches, and this light has a wavelength that literally kills virulent bacteria, not healthy bacteria, but virulent bacteria. And it stimulates, for the most part, your own natural stem cells in your jawbone to regenerate bone. And if you were to see some of the x-rays that I have taken and actually have published of some patients where this procedure has grown new bone, you would be amazed. So it's an extremely patient-friendly procedure because the next day patients go back to work. It's not like they're dealing with healing complications. And now I incorporate a concept of getting their diet in a healthier state to help support not only healing, but their quality of life going forward. The sad thing is, I'm still seeing lots of patients when I'm seeing patients, but I would say only 5% or so patients really are interested in making a lifetime change that they would need to change their diet and lifestyle.
So what would be the ramifications of that then? Let's say I had gum disease, I came to you, I got the great laser surgery that you're talking of. I didn't change my diet at all. I just kept on going as I do. Would it never come back again?
You would have to involve yourself with a lot of maintenance procedures, cleaning your mouth properly every day, of course. That's a good thing to do no matter what. Seeing the dental hygienist maybe 4 times a year for them to help you clean things that maybe you're not cleaning well, or because infection is starting to become a problem and we have to try to avert it. We're still dealing with manifestations of disease that are caused by improper food choices. Now, I'm not going to say that if you eat all the right food, you won't have periodontal disease, but I will say our primal ancestors ate the right food because they didn't eat processed food and they didn't have toxic substances that invaded their body, and they did not have dental decay or tooth decay or gum disease. So I can't tell you that if you follow my recommendation, you'll never have that, but I can suggest that's a possibility.
So would you be able to then look in someone's mouth, and would that give you an insight into their wider health and wellness just by examining
Yeah,
it?
it's interesting because the mouth is a mirror to the body. And many, many diseases that develop with named manifestations, malignancies, and all kinds of things will show in the mouth. Most gut problems show some kind of changes in the mouth. The mouth is just the beginning of the digestive tract. So if there's inflammation in the large and small intestine, there's probably inflammation in the mouth. And there are studies that show that when the gut's bacteria becomes out of balance and starts to become unhealthy, the mouth bacteria becomes unhealthy. You have to have an unhealthy gut bacteria population before you have a change in the mouth bacteria population. But here's what happens. If you have bad bacteria in the gut, and now you have bad bacteria in the mouth, and you treat your gut and everything gets better in your gut, but your mouth bacteria has gotten advanced to the stage of periodontitis, which is the infection in the jawbone, now that disease in your mouth needs to be treated in addition to your gut, because what's going on under the gum can penetrate the bone around the roots of the teeth, just like infection in your gut can seep into the circulatory system and create chronic inflammation throughout your body. So now you have 2 areas of potential chronic inflammation in the body: a bad gut and a bad mouth. But you don't necessarily get any disease in the mouth until something's really wrong with the gut and chronic inflammation is a problem. Then the bacteria in the mouth start to go crazy. The bacteria in the mouth are basically very homeostatic. They provide a number of biological purposes. And if you killed the bacteria in your mouth, you will be a very sick person. So there's many bacteria in your mouth that are very healthy, and even bad bacteria are kept in line because of the good bacteria. But when you start to use, for example, a antimicrobial mouthwash, and you kill what you're thinking is bad bacteria in the mouth, you're really killing a lot of good bacteria in your mouth, and everything starts to break down. you're not really treating disease, you're creating disease. And you're creating damage to the rest of your body.
Okay, so obviously mouthwash isn't something you'd recommend for a daily habit, but what daily habits would you recommend?
First of all, of course, I recommend a nutrient-dense diet. If you can do that, great. If you can't do that, okay. If you're not going to do that, the least you need to do in your mouth would be brush correctly into the gum. So if you think about the gum around the tooth, like the cuticle around your nail, if you cleaned your cuticle around your nail, you would take a scrub brush and scrub it with the bristles at a 45-degree angle where the skin and the nail bed is, so that you clean whatever is in there. So where the gum meets the tooth, you need to think about that space. You need to clean like you would use a scrub brush. And you put the bristles of the toothbrush at a 45-degree angle on the cheek side as well as the tongue side, and you just clean it horizontally to scrub whatever is there out. Now you're doing it gently. You're using a soft bristle nylon toothbrush, but you're cleaning the bacteria. The most unhealthy bacteria are lodged between the teeth. So you have to clean between the teeth. Dental floss is one way. It's not very efficient, but the best way to clean between the teeth will be a little brush, almost like a baby's brush that you would clean a bottle with, but these are very, very tiny, and they slide between the teeth like a toothpick would, but a toothpick is not healthy. These have many, many little filaments that you can scrub where the gum meets the tooth. So you'll be removing the unhealthy dental plaque. Once you do that, you'll remove the biggest source of infection that creates gum disease as well as tooth decay. Also, you would want to clean the base of your tongue. So you can take a teaspoon, invert it, put it back on your tongue, on the top side of your tongue, as far back as you can before you would gag, and then scrape the teaspoon forward, and you'll pull off a lot of the bacteria and remnants of food particles that create most of the bad odor that you might notice in a person's mouth. So that's the best way to clean your mouth. You're disrupting the unhealthy bacteria, but you are not killing them off, because if you were to do that, you would also, like a mouthwash, you would kill all the good bacteria too, and you'd create problems. And you would do this twice a day, first thing in the morning, last thing at night.
Would you recommend anything else like coconut pulling or?
Yeah, so I like the simplest thing that is healthy. So you can take your toothbrush as well as these little brushes. By the way, the brushes are called soft picks. They're made by a company called Gum in the United States.
Oh, well, we'll link to that in the show notes.
I would use your toothbrush, and I like electric toothbrushes because they're just more efficient. I would use your electric toothbrush and dip the bristles in some coconut oil, and then dip it in some baking soda and brush with that. That's going to be the most effective cleaning technique that I think you can use to clean your mouth without harsh chemicals, without harsh abrasiveness, because baking soda is not very abrasive at all, even though you may think it is. And the baking soda actually helps to stabilize the pH. And the coconut oil has some antibacterial, antiviral, antifungal properties without killing off everything. So it's a good cleaning method. It's much better than commercial toothpastes, which I don't recommend at all. And you will be able to maintain a relatively healthy mouth. But that is only secondary to a nutrient-dense anti-inflammatory diet.
Absolutely.
That's absolutely critical.
Okay, and so you mentioned not to use toothpaste. Are there actually any toothpaste on the market that you would recommend?
Well, I'm going to unfortunately become commercial here because my partner and I have just created a year or so ago a company called Nuda Organics. It's not commercial yet, but we've developed some organic toothpaste that would be healthier than what's available in the marketplace right now. So it's going to have a flavor, it's going to have a consistency and a texture that might be more pleasing than just coconut oil and baking soda. But coconut oil and baking soda is an excellent choice. Other than that, there is no commercial toothpaste that I really like.
Right, excellent. Thank you. Thanks for that little commercial too. Let us know when that comes out.
I will.
Excellent. So, Dr. Dan, a lot of our listeners are very fit, extremely fit. some of them, and are very competitive in their fields. And I know you've always been relatively fit yourself. Perhaps you would say at one stage you were maybe fit but not healthy, and that's something we're seeing a lot. I guess a twofold question. One is, do you think you can be fit without being healthy? And in your experience, or based on maybe studies that you know about, does a person's fitness level impact their oral health?
Absolutely. Mark Sisson, you may be familiar with the name Mark Sisson.
Absolutely.
He's got an international presence, and he wrote a book maybe a year to 2 years ago called Performance Endurance, I think.
Primal Endurance?
Primal Endurance.
Yes.
Okay, it's a phenomenal book. So his story is exactly what you're talking about. He was an endurance runner. He was very healthy, supposedly, but he was really unhealthy. He was fit, but very unhealthy. And his body was breaking down because of the oxidative stress from all of this endurance training that was not being supported by a healthy diet and not enough time for his body to repair after each session of endurance training. So there are a lot of people, especially CrossFit people, that get involved with very aggressive, actually destructive type of fitness training without allowing their body enough time to repair before they do another set. And they're eating quite a bit of unhealthy carbs and not other healthy nutrients. So they're actually creating insulin resistance. They're creating a huge amount of destruction in the joint, problems with growth hormone, and a whole host of problems that actually become feeding the bacteria in a way that you get a gut dysbiotic relationship, and then the inner lining of the intestine starts to break down, creating what's called a leaky gut, and now things are getting into the bloodstream that are creating chronic inflammation and immune response and even autoimmune diseases. And now it becomes a vicious cycle, and it just grows and grows and grows, even though you're physically fit, maybe, but you are very unhealthy. So let me just tell you about some of my contemporaries. Now, I'm 70 years old, so I have some history here. When I was in my, I would guess, 30s or so, and I'm not sure if it's the right time frame, but Ken Cooper was a physician. He was very, very popular in Texas, and he was into jogging. He was the one that really promoted you had to jog 5 miles a day, 5 days a week, and do it for the rest of your life. And a lot of my contemporaries started doing this, and they were doing jogging, and they had no problem. They were healthy, they were skinny, they seemed like they were fit. They didn't eat right because no one knew how to eat right in those days, and they haven't changed their ways today. But everyone, and when I say everyone, every one of my contemporaries that were doing that at that time has now had hip replacements and or knee replacement surgery, because the impact of this chronic aerobic running is not the way our human species evolved to be. We were not meant to run like a jaguar. We were meant to sprint and run away from things or run to kill things, but not run marathons. Our bodies never were designed to do that. Now, we do that, and we love to do that, and we feel good when we do that, but the impact on the joints may come back to haunt these individuals that are doing it too aggressively without allowing the body to repair. I don't think the problem is there if you do it and then you give yourself 10 days to repair. It's when you do it day in and day out. Maybe you rest one day and then all of a sudden do it for another 5 or 6 days in a row. I think that is very destructive because we're not designed to do that.
Yeah, that's really, really interesting, and a lot of people, I guess, don't really think about longevity when they're doing that. And then I'm sure a lot of them look back and go, or a lot of your colleagues look back and go,
I think when we brought up Mark Sisson, I think Mark actually says that many times because he is maybe 5 years younger than me. I'm not sure, maybe a little younger than that, but he's in his 60s. But he can relate to this pounding of the body on a daily basis, and it damaged his body, and he talks about that in his books.
Well, all our chronic cardio listeners are all switched off by now. They don't want to hear about this. So,
It is. What can I tell you?
But very good point. I think we might have a lot of listeners who really need to consult someone like yourself. And I assume there aren't many periodontists out there that have that sort of holistic approach. I know you do online consulting. Can you tell us a bit more about that?
Well, on my website, which is a simple way to get to me, drdanenberg.com, which is drdanenberg.com, there is a link on the navigation bar to consultations. And if you were to click on that, it just tells you all about what you would need to do to have a Skype conversation face-to-face with me. But basically, a person would fill out a patient questionnaire, which talks about their life, what they're doing physically, what's going wrong with them, what kind of medications they take, how they sleep, how they eat, a whole host of questions that you would expect to be answering if you were to see a physician that were to see you in a clinic. And then I have them fill out a 3-day food journal. So I get an idea, and this is all online, I get an idea of exactly what they're eating, when they're eating, what their emotions are when they're eating. It also helps me to identify what's wrong and what's right with their diet. They have to put down what kind of exercise they do during the day, what their bowel movements are like during the day, because that tells a big story. And then all that information comes to me, and if they have specific questions, they email me their questions. I have had many patients actually have their dentist email me their x-rays, their dental x-rays, for me to look at them and give a determination of what I see. I can't diagnose over the internet. I can't treat over the internet, but I can offer a lot of suggestions and direction. And I think that there are always clinicians available that can provide good treatment, but you might have to seek them out. It's not going to be maybe right down your street. You're going to have to look for them. But I can give people ideas of who to look for and what to look for and how maybe to take care of their mouths and their bodies a little better.
That'd be great. And some of our listeners do travel a lot as well. So if they're in South Carolina, they can come and see you at your practice. I'll make sure I put all the details in the show notes for that. And I'm conscious of your time, Dr. Dan, but I do have to ask you, I heard a rumour that I'm not sure exactly when, maybe mid-July, there's an amazing book coming out called Crazy Good Living. Would that be yours?
Yeah, that would be my book. And I'm excited about this book. It's been in the works for a couple years. Actually, I have published some other things that were not related to this subject at all. I'm basically a new author. And to get a real publishing company, this is not being self-published. So to get a real publishing company is not an easy task. So I found a literary agent who I guess fell in love with the book after many literary agents gave me a thumbs down. And this literary agent found a publisher. So Electra Press is the publisher. They are gearing up to put it out, release it on July 15th, 2017, this year. And they've gotten 6 or 7 pre-publication endorsements from a variety of people, which are very exciting for me. And some of these people are well known. So they've looked at it and said, this is kind of a unique way to look at health from the mouth standpoint. So it's a different way of understanding what's going on. And I'm excited.
That's great. Well, we'll add the link to your book as soon as it comes out to these show notes. We like to ask all our interviewees, do you have a tattoo?
No.
You don't? Okay.
No.
And I'm not sure if you've ever thought about getting one. If you were to get one.
No.
No? And why not?
Why?
Yeah. Why not?
Yeah. So the tattoo ink industry is very not well controlled. And there are chemicals in tattoo ink that are highly toxic. And some tattoo inks may not be, and others are significantly. And there actually are, 6 or 7 peer-reviewed articles in the last 2 or 3 years about this particular issue. Obviously, there's not much written because it's just recently being evaluated.
Wow.
There have been, I just read an article of a person that had a tattoo and it was predominantly red, and they developed a carcinoma, malignancy in the center of that tattoo. I can tell you something interesting. When I was in practice seeing a patient maybe 20 plus years ago, so this is a long time ago, this is a guy that had tattoos completely over his body. His arms looked like they were completely painted. His legs looked completely painted. I didn't see much of his other parts of his body, but I did see his mouth. And it's very interesting. When I looked in his mouth and I looked at the soft palate, that's the area, if you open your mouth wide and you put your finger on the roof of your mouth and you went back with your thumb, and all of a sudden it wasn't hard bone, but it was really soft, and that's where you would start to gag. That's the soft palate. There's all kinds of vessels in the soft palate that are very obvious that you can see. His mouth, his soft palate was just like spaghetti colors of blue, red, yellow, green. It was all the colors of his inks from his tattoo. Now, the only way that could happen, in my opinion, and this is way before I understood tattoos at all, but it probably was that his tattoos were improperly placed and they got it into his vascular system, and the dye traveled through the vessels and deposited in the very thin vessels, and I could see them. I could see the vessels that were colored. I am concerned of toxic substances in our body to start with, and I don't think that tattoo inks today are well controlled enough, and there are a variety of chemicals in these inks that are highly toxic. So once the industry, if it ever gets to the point where this is controlled better and toxic substances are not part of the ink, that would be a different story. But right now, I'm not going to do it.
Excellent answer, and very different to most of our
I'm sure.
Our interviews. But you're talking to the converted. I personally don't have a tattoo either for that same reasons. Excellent. Thank you very much, Dr. Dan. I appreciate your time.
I will say one more thing about tattoos. I did see another article, very recent, that suggested that tattoos support the immune system.
That'd be an interesting one to link to if you can dig that one up for us.
Yeah, I could. So therefore, there is controversy, but there's controversy in everything. And just because a person says it may support the immune system, it may not be a controlled study. It may be more anecdotal. I mean, all kinds of things. And even if it worked for one, the other 99 in another study that got very ill obviously would disprove that study.
Absolutely. I'd actually love to read that one if you can find it.
I will.
Excellent. Thank you very much, Dr. Dan. Appreciate your time.
It's my pleasure. It's been fun.
Thank you. Bye-bye.